When you see your child suffering, as a parent, you want so badly to just do something about it. Steve Petty saw that. His son Cole was struggling. Things were not going well at school. There were also struggles at home, and Cole needed some help. And they found what they needed from our friend Dr. Robert Reynolds. Steve, Cole, and Dr. Reynolds are all here to talk about how they teamed up and turned things around for Cole and set him on a better path. Welcome to all of you.
Thank you.
I look forward to hearing your stories. But Dr. Reynolds, talked about a little bit first, Cole, as far as the issues that you were dealing with. He came to you diagnosed with ADHD and ODD, correct?
Oppositional defiant disorder.
And you, unlike the traditional path, which would have been a lot of medication, you take a different route.
Yes, well, we take a lot of, as you know from past shows, we do a lot of computer-based training to help kids learn to manage their behavior better. We do a lot of work with the families to get the situation at home engineered more effectively, and we go to the schools. And I think that the Pettys have a compelling story to tell about all of those things.
Right. Cole, let me start with you. How were you feeling before you went to the clinic? What kind of things were you experiencing day to day?
It was just tough. I had a lot of stress on me. My work, I just couldn't do it, and overall, I was just not happy with my life at that point. And
Dad, what were you noticing?
Well, yeah, academically, he was really struggling, and you know, we had been doing the medication thing for a while, you know, since second grade, and things just weren't working. It was actually, it was going downhill rather than improvement. So we were looking for a different approach.
Right, so it's not that you were against using any medication, you'd actually tried it, but for you, it didn't work.
For years we were doing it, yeah, and the medication just seemed to get increasing in doses, and we weren't seeing any positive responses from it.
Okay, so Cole, what were some of the things you did at the Reynolds Clinic that you thought really helped you?
The neurofeedback that we did helped me and focus it more in school. And overall, he just taught me things I could do just to help me out with everyday life.
Coping strategies.
Yeah.
So that's part of this is, Dr. Reynolds, right? You do a lot with parental coaching to give parents the tools to know when it's not just behavior, and also kids what they can do when something's bothering them.
Right, because when they're given that kind of information, then they can really do something about the course of their lives. And too often, all parents are offered is medication. And I just want parents to know they don't have to go that route. There are alternatives that are not just effective, but are effective over the course of their lives, so that they're not just dependent on medication the rest of their lives. Cole's minimizing things, but he was failing all of his courses, and now he's in danger of making the honor roll.
In danger of making the honor roll. But so when you're doing the neurofeedback for you, it was also something, did you look forward to going? I've been there before. It's almost like video games and fun things that as a kid you probably didn't feel like you were doing something you didn't want to do.
Yeah, it was pretty fun. Yeah.
Not necessarily at first.
Yeah.
Okay.
You didn't find it very exciting at first because it wasn't like the regular video games you're used to.
Right.
It's more for to train his brain. So at first he wasn't that excited about it, but he eventually got used to it and said, okay, I'm willing to give it more effort.
What about you? I mean, it's an investment of time and money, and it's not the standard path to do this. So how did you prove to yourself, okay, this is going to be worth my time and my money?
Well, it is a long road. It's not something that takes changes right away. You know, we started this last June, and we're continuing with it. Yeah, it is an investment, but when you're at the point in which you don't see things improving, as a parent, we're going to make that investment. So we were willing at that point to try something different.
And you noticed a difference pretty quickly?
Not necessarily quickly. We're talking, it was months. You know, Dr. Reynolds is up front saying, you know, this could be something that could take a year,
right,
but it's going to get better.
Yeah, you noticed we were going on the right path, I guess.
Yes. You know, I'd say at the month 3, we were noticing some substantial improvements, and we've had a little bit of a roller coaster. We've had some setbacks, but overall, this is a different kid than we had in June.
Do you feel that way, Cole?
Yes, absolutely.
How is it different for you when you get up and go to school nowadays?
Well, I'm happy to go to school. I feel that I have the motivation to do most of my work, and so when I wake up, I just get ready. I'm like, okay, I got this today. I can do it.
And the battles that the family went through to get Cole to even go to school was monumental. Now he wants to go. I mean, how great is that?
So it's the internal changes, and from a scientific perspective, you see it as you're helping him rewire his brain.
Exactly. So he's more capable, confident. He's able to realize his potential, and that was also what was frustrating Cole. He's a bright kid. He's got a high IQ, but nothing was coming. He wasn't producing because his brain just wasn't working efficiently. He just needed a tune-up. Think about it that way. And as his brain got working more effectively, look what he's capable of doing. Honorable.
So when you come to the Reynolds Clinic, you came with a diagnosis. You knew what you were dealing with. It was ADHD, it was ODD. But in the case, what if you just are noticing things? Can you come and actually diagnose for parents and then do a treatment plan? Or
yes, that happens all the time, Kara. I'm glad that Cole is here because I think Cole represents more or less the type of kids who come to my clinic, but we have kids on a whole range of issues. We have kids coming on the spectrum, autism spectrum kids. We've got kids coming because they've got anxiety, because they've got depression, because things aren't working out in their lives, not just ADHD and ODD. But I would say about half of the kids who come to my clinic probably have ADD or ODD, or a combination of both.
And you can help decipher what that is. But more than that, you care less about the label, but you're going to get the techniques of how to change whatever it is you're dealing with.
I want to teach kids the skills that they need to manage their lives and not depend on the medication.
Okay.
And the approach of Dr. Reynolds is very multifaceted. You know, we struggled with the medication route because that's all we were getting.
Yeah.
And we had constantly asked a past practice, well, there's got to be something more here.
Yeah.
And so Dr. Reynolds offers the counseling. He offers the parent coaching. He offers the educational support. So it's multifaceted, multi-directions to hit it. So that's what we really liked.
Congratulations, Cole. We're happy to see that you're doing better. And thank you all for being here.
Thanks, Karen.
And we want to let everyone know that if you're wondering, I want to learn more, Dr. Reynolds is hosting 2 upcoming free seminars on ADHD. One is on Wednesday, May 17th from 6:30 to 8:30 in the evening. If weekends work better for you, there is one Saturday, May 20th at 9 in the morning. Both will be held at the Reynolds Clinic in Middletown. Go to reynoldsclinic.com to register. Thank you all.